part of the plant. Okay, Aapww it belongs to. Okay, this pipali, whenever it is dry, I will show that dry pipali is also there. This is used basically for the cough and the bronchial asthma. Tuberculosis, lung tuberculosis is there, you can use it. Okay, so we'll proceed. There are many plants I have to show. And it's basically one formulation which is very well known, that is a three cut. The three means a three and initiation of the kapha dosha.
One is Marish, Piper, Nigrum, and third one is Pipali, that is Piper longo. So this Marish is also useful in respiratory disorders, mainly in the cough dominant any disorders. So the main ingredient of Trikatu is Marish. The second one is Swaskutha Ras. So it is used in bronchial asthma. Then even in breathlessness, sometimes it feels breathlessness in the winter. So we can use this one. It is also used as a spice in Indian food. So many Indian food it is used, right? So as a food plus as a medicine.
In the food we know almost we use this powder is used in soup, and that because it is a very good appetizer and digestant. So in many of the Chinese food, this marichezia, pepper, nigrum is used. There's a paw of the frog. So this is a manduka. The paw of the frog as a pearl.
Sometimes one ingredient as a food doesn't if you heard about
Say if you don't have mummy at your home, keep haritaki. It plays the role of your mother. It is used anywhere, in any diseases. You can use it in an eye disorder, if eye problem is there, GI, gastrointestinal problem is there, constipation is there. You can use haritaki according to the very season also. You can take with the honey, you can take with the sugar, you can take with the jaggery, like this.
geriatric disorder.
So you can use urinating antioxidant. If you want to use, you have to cut like this. Take a pulp of this. This is a useful part of the aloe vera. It is a cosmetologically used. You can apply on your face, your skin complexion will enhance and soften your moisture in your skin. It is also used on the hairs. It is also hair tonic, and actually it is also useful in a medicine. You can apply that jasmine oil over there. But keep in mind, this is a good. Is only present in Mumbai in our garden only. Okay. Now it is fruiting. You can see the fruits over the fruits looks like green. Okay, this is unripe now. For your sake, we have removed it. Okay. Want to see? Its Latin name is the Iliocarpus granitus. Okay, its use is basically in a hypertension. Okay, in a depression, it is a good antidepressant. It is used as a cardiotonic. It is also used in a bronchial asthma, and somewhere pickle of these fruits is also made for the eatable, as the eatable thing.
Rudraksha is used and keep near the heart. So this garland is there in with black thread or any thread, and we are using Rudraksha mala, right? To make calm,
like this only.
Yes.
This is the original one.
It will calm your mind when you
calm. This is a tranquilizer and sedative.
Family Condotaceae, English name Balearic marrow balance. It is also it is a tree about 60 to 80 feet height. We can use it in respiratory system, that is we used in cough and asthma also. It is act on gastrointestinal tract. We can use in anorexia, vomiting. It improves appetite, improves digestion also. It acts as a kesha.
So it's hair tonic. If you have a grey hair, we can apply the oil made up of this, the fruit rind, and apply over for the graying of the hairs. the beauty of frondosa. Palasha, of which we use the seed of this plant, which is the anti-helminthic. Okay, in the gastrointestinal abscess, we can use this palasha bija as an anti-helminthic. Okay.
Everyone have mosquito repellent?
I will explain it. Okay, this is a punnag. Okay, this punnag is mostly used as a substitute. Actually, it is not a proper drug, but it is used as a substitute. The stamen of this flower is used instead of the nagakeshara. Nagakeshara is a plant which is very useful in a bleeding disorder. That is a hemostatic. If we don't get a stamen of the nagakeshara, we use the stamen of this plant of the punnag. Punnag, Carophyllum, Menophyllum. Okay, punnag. This is a shonyak, Oroxylum indicum. You all know the dashamulas. Do you aware of the dashamula? This is the one of the content of the dashamula. Dashamula having the two parts, Bruhat Panchamula and a Lagu. Bruhat is a big, having the big roots, and the Lagu is having the small roots. So be in the in group of the big Bruhat Panchamul, this is the one of the plant, and which possesses the anti-inflammatory and analgesic activity. It is also astringent in action, so we can use in a diarrhea also. Okay, shonyak. This is a Agni Mantha. 1 second. Small. Yeah, look, small. These leaves are identified as these leaves having the petrol-like smell. If you crush and you will take a smell. Yes. This is the Agni Mantha. See what we use petrol tech. Petrol is responsible for fire. So Agni Mantha. This also is a Agni Mantha. That Agni is of the abdomen. That is a digestive appetizer. Okay. And this is also one of the content of the Dashamula. There are two plants are there which seeds lies inside the fruit. But there are two plants of which the seeds are outside the fruit. One is a cashew nut and another is this marking nut. That is a
Bhallatak. Bhallatak is a semicarpus anacardium. This one, Bhallatak.
This is the seed of the.
When we cut this one seed, the oil will be secreted. That oil is irritating in nature, so we need purification of this seeds.
So very good petrol. Very good medicine for the sexually transmitted diseases like the syphilis and the gonorrhea. It's very good treated by this chopchini. Also, this is used in the osteoarthritis and the rheumatoid arthritis along with the shatavari and the ashwagandha. Ashwagandha, you will know it. See, the leaves are like that naksomika, but it will have the thorns over there. With thorns we can see. And this is not a tree. This is a climber. Okay, the kuchila is having a tree and this is a climber and having the thorns over here. But the shape of the leaves are almost same like of the kuchila or a kupila. This is a madana phala, emetic nut. Emetic nut, madan phal. No? You know the panchakarma woman? Yes. So for woman, this madan phala is used. Why it is used? Because it is used in a kapha disorder, kapha vitiation. It causes the woman, it removes all kaphas from your body without harming your body. You will be safe, you will don't have any allergic reaction, you will don't have to worry while giving the woman with this madan phal. It is very safe. And this another, thorns. It is having the thorns over the twig. This another is a Vedanga. Vedanga, Embellia ribes. The one of the main drug which act as a Krumigna, means the anti-helminthic. Okay, tapeworm, hookworm, we can use it. It's a Vedanga, Vedanga rishta is a famous, and the Vedanga Kurmi Kutharas, Kurmi Mudgaras. These are the formulation of the Vedanga. Anti-helminthic drug, Vedanga, Embellia ribes, Madanfal, Randia spinosa, because it is having the spines, and the fruit is round in shape. So Randia spinosa, okay, which is used as a emetic nut.
English name is Kurchi and Latin English name is Kurchi.
Kurchi bark.
And Latin name is Volarina anticentrica, belonging to the family Apocynaceae. It is 30 to 40 feet tall tree. Its flowers are white color flowers. It has two varieties, male and female. Male is Volarina anticentrica and female is Wrightia tinctoria. It is mainly its seeds and bark stem are mainly used in medicine, and seeds, these are seeds of kutaj, and in Sanskrit it is called as Indrayav. Indra means Agni actually. In Ayurvedic way it is increase your appetite, so it is good in your indigestion. As ma'am said, it is good appetizer, and medicine of which kutaj is one of the content.
Practitioner, you should have the dried leaves at least at your clinic or the center, because this is a mainly used in any of the vata vitiated diseases. Means if you have pain, swelling, there can we use this. If you are giving the steam to the patient, if you crush these leaves in your steam pot, then you will get a smell and the pain relief action very fast, rather than giving only the steam of the dashamula. You can crush these leaves and put in a steam pot for the steaming purpose. Also we can crush these leaves and apply over the swelled part, so it will act as an anti-inflammatory also. Nirgundi oil is also used for the massage. Make a paste, chutney like, and apply over there. And we can use oil of this also for the massage purpose. Wherever pain is there, that may be the osteoarthritic pain, that pain may be the lumbar pain may be there, joint pain may be there, you can use this Nirgundi oil there. Okay? 10 minutes only. Another oil, which you should have at your practice or your clinic or as a therapy center, that is a Sahachar Taila or the Saireg. Yeah? It should be in your clinic. So this is good for the vata vitiation. Sahachar oil is given for the local application also. The Panchavalkal is having antimicrobial activity, and that research is done over here at institute. That Panchavalkal oil was kept at the cervicitis, the swelling of the cervix, for the cancerous patient also, and we are getting the good results of this Panchavalkala. Okay, so it is having an anti-tumor activity also, antimicrobial activity, and one of the content is this Vata Ficus bengalensis. And one another use what I have seen. If the patient is having a habitual abortion, that time the point of this is what we call this pointed region mixed with the milk. Paste it with the milk, and you can give it the patient having the habitual abortion history, and we get a good result of this.
This is a Bengal fact. It's a Bengal
fact in German. Use of this is a sorin test or the Garcinia indica. This medicine is now very popular in India because the medicine prepared by it, prepared from is a Garcinia. That Garcinia tablet is good for the obesity, and previously it was used for the obesity because it is having a hypolipidemic activity. It acts as a scrubbing agent, and before that we were using this Vrikshamla for the urticaria. If the visheshan of the pitta is there, and if you are having rashes over your body, you can apply that vrikshamla or the fruit over your skin. And also this is using for a cooking purpose. Siniya. Now this is not good in condition wash, but if you tell, its Latin name or the binomial name is a Salmalia mulbarica. Okay, its leaves are used, its stems are used, and its exudate is basically used. That is called as a mocha rasa. That mocha rasa is used in a picha basti. The picha basti is very good in the IBS, irritable bowel syndrome, ulcerative colitis. The exudate of this is used, and that is also having a hemostatic action also. Yes. Okay, we'll go ahead. This is a Kara
चंदन, not वीरप्पन one. उनको पता नहीं होगा. चंदन, you know the चंदन? Sandalwood.
Shwet chandan hai.
This is a white. Shweta chandan. There are two types of the chandan: Shweta chandan and Rakta chandan. Santalum album. Album means a white. So Santalum album is a white chandan, and Santalinus indica. They are having the egg-like shape. Okay, these leaves having the egg-like shape. This is a Rakta chandan, and this is a.
What you get normally is this, the white variety.
Today I have the pleasure of introducing two great stalwarts of Ayurveda, Vaidya Nath Karni and Vaidya Sarpudhar. Dr. Sachin, you have a successful practice in Pune and you travel every year for 3 or 4 months to Europe to treat European patients. Can you tell me what the difference is of treating patients abroad and teaching and not treating patients abroad and them here in India?
Basically, when we are practicing Ayurveda in these two different types of world, Eastern world and Western world, the problem of the Eastern community are different and the problems of the Western communities are different. Most of the Indian population or majority of the Asian population are suffering from the metabolic disorders like diabetes, hypertension, heart disease. Whereas in Western world, I did not observe so many diabetic patients. Their problems are different, like majority of the patients having problem with psychological ailments, psychological disturbances like feeling of loneliness, anxiety, depression, neurosis, burnout syndrome, insomnia, then tinnitus problem. So these all problems are not metabolic problem, rather this is associated with the behavioral and their lifestyle related problems. So I observed majority of the problems here in India are due to vitiation of the kapha dosha, whereas majority of the problems I observed in Europe are due to vitiation of vata dosha. So that is the basic difference between the problems here in India and in European country. So when I practice Ayurveda in Western world, I have to tackle or I have to observe the patients on the basis of various dimensions like physical dimension, mental dimensions, or even on the spiritual dimension also, because unfortunately people from the Western community are taking the meaning of spiritual life in a different way. So living in your home and living with your family also, you can have the spiritual dimension. So that message I am giving every time to Western community. And Ayurveda as a system of medicine, we say that it is a science of life. So it is not only limited with only the medical therapies, but to understand the human being, understand his emotions, understand his passions, understand his desires, and it influence on his symptoms. So that is basic difference between Indian population and Western community. Western community have everything on a material level. Everything on material level, they are very superior than Indian population. But if you analyze the level of happiness, even the poorest man in India can find the level of happiness. The face is more happy as compared to Western rich people. So that is what I mean to say, that on a materialistic level, the Indian population is poor, and on a psychological level, the Western population is poor. So we have to tackle the Western world on a psychological dimension, on Vata associated symptoms more than Indian population. That is the basic difference between the practice here in India and in Western world.